Okay, perfect. Well, first of all, congratulations, Rob, on the Distinguished Leadership Award. Andres and I are very excited that we can interview you for this special occasion. And we've pre-recorded it using Zoom because we can edit it later and we have more time to enjoy Hawaii. First of all, you have been a big inspiration to the both of us, and one of the big reasons why we pursued a career in nerve surgery. The first question we have for you: who inspired you to go into peripheral nerve surgery?
Well, thanks. I think this is a prouder day for me than for you. Seeing both of you around the world really instills in me the ideas that I've been successful because you've been successful. So thank you, and what an honor. Um, Thinking about my career in peripheral nerve surgery, I'd have to start at the beginning, which was my father. I typed for my father when I was 7 years old. I got paid $1 a page, and I had to do all of his manuscripts. So I learned a lot of words that are familiar to us, like anterior interosseous nerve syndrome, things of that sort, and arcade approach at 6 or 7 years old. I
Wow.
became a good typist and I made some money. But I would have to say that over the years, I sort of grew interested in what those words were, and of course, what my father did. So I think growing up and going through medical school, I was always interested in anatomy because I had met people like Emmanuel Kaplan early on who were important in my father's career, who then I was able to put into some context as to what those people did with their careers. As a result, anatomy was always important to me, but I have to circle back in life to say that my father was and is my inspiration.
Okay, that's great. And you're also a great mentor yourself. And can you explain to us like what it needs to be a good mentor and to be really be effective?
I think, first of all, to be a good mentor, you have to be a role model. I think as a leader, you have to lead by example and be a servant leader. So I like to show people that number one, I'm interested. Number two, I'm energetic. And number three, as I work harder.
Yeah.
So my car is in the hospital before the residents, and I think that's important for them to see Spin Man.
Yeah.
Uh, I get a good parking spot. I think the biggest thing is to have a big picture of that you're having the ability to launch someone's career. So you need to give them more than a case report. It has to be a context of something bigger and something you create together. And the learning and the energy bring together sort of this force that's bigger than the two of you. Um, I think that's been my approach.
Yeah, great to hear. Great to hear. I definitely agree on that. And you're still a great mentor to us, to both of us. Andres has the next question.
Okay, I'm going to ask you, Dr. Spinner, a little bit about research. You have made an amazing contribution to different areas of peripheral nerve research. And I was looking PubMed, you have published over 700 papers. And even in the last 5 or 10 years, you have like around 50 papers per year. So the year has around 51 weeks. So that means every week you have a new paper. So today we are recording that on Saturday. That means tomorrow, Sunday, we will see a new paper from Dr. Spinner. So, and another thing that I always remember when I'm talking to you about research is how you can remember all your papers. We are thinking about a project, and then you told to me, oh, Andres, check this paper from 2010 in neurosurgery, first author, blah, blah, blah. So, Dr. Spinner, is there any study or project that you feel has had the greatest impact in the field, or which is your favorite area or paper or project that you could share with us?
Well, thanks for that. And I would have to say that we're only starting to go now. So I feel young and I have a lot of ideas, so I need to do a lot of work. So next year will be a bigger year. It's also not about quantity, it's about quality. And I think when you get a little bit older, you want to combine projects rather than separate them and salami slice. I think many of my early ideas and confidence came from probably my first major onslaught, which was snapping triceps. And I think that was really an important area. I was a resident. And it started from a single case. I saw a patient that was interesting. I didn't know what it was. There was a case report. I saw it, recognized it, and that turned into sort of about a decade of work. But I was a resident, and it also linked me to another important person in my mentoring mentee life cycle, which was Richard Goldner at Duke. I was a Duke orthopedic resident. This was probably my second or third year of orthopedic training. I saw the patient. I happened to speak to Richard Goldner, who was the consultant at the time. And Richard and I had, I would have to say, sort of this hidden relationship before the relationship. His father was J. Leonard Goldner, who was the old chair at Duke, who was a good friend of my father's. I had the opportunity to meet Dr. Goldner when I visited Duke at about age 8. And that's how I even first heard of Duke University. But I went with my dad on a trip. And I hope we get to talk about the importance of balancing family, because that trip with my father, when he was presenting and visiting Duke, et cetera, was really important for me because I got to spend some quality time early on with my dad, got to meet Dr. Goldner Sr., and that lasted a whole lifetime and probably propelled me to any interest in going to Duke University. Go Blue. But Richard Goldner and I had the similarity of having famous fathers. And when you have famous fathers, you're in a club that some people like to liken to nepotism. And it's a difficult thing to navigate. And I credit Richard in navigating it very well, and he helped me. And we had this unwritten handshake that we never really spoke about, but we felt. But Richard was a wonderful, ethical, gifted, brilliant surgeon with a great sense of humor. And through snapping triceps, we've become really good friends. But what snapping triceps led me to do was understand that number one is it's not just a case report, and it's fairly common. How to diagnose it, how to treat it, how to image it, how to prevent it, how to create a model, how to have a hypothesis, how cubitus varus is not just a rare thing, but it happens in athletes with big triceps. And cubitus varus can change the carrying angle, which is anatomy, and how cubitus varus can then link me to posterolateral rotatory instability and Sean O'Driscoll. So through one case, I've created a lifetime of questions and hopefully some discoveries, but more importantly, friendships and teamwork. So I would say that would be the early one. And I think using that as a paradigm, intraneural ganglion and other types of tumors that we've worked on over the years have come forth.
Great, great.
Great.
Dr. Spinner, I'm sure there are a lot of residents in this room or junior faculty. Which advice could you give to the junior staff that they want to have a future in research in peripheral nerve? Which advices could you give to all these people to have a successful research career?
Well, first, I would say peripheral nerve is a great field, so stay with it. Number two is it's an orphan drug, so there aren't a lot of people in the field, so there are lots of huge opportunities. Number three is the field is in its infancy. So you can make really considerable contributions. My advice would be think big, not small, because I think when you silo yourself, you're limiting the contribution that you could make. So if you think something is rare, think bigger. If you think that there's no future in it, you're thinking small. Always try to ask questions, and I think one of the things that I've hoped to have taught you is how the first study becomes the next study, which becomes the next study. Mm-hmm. And that's important, and you just have to keep asking questions. The other thing is to be subspecialized, because I think the more you know about one field, the more you can contribute. And I think, how do I know the literature, Andres? Is, well, this is what I do. It's what I think about. It's what I know. So when you ask me my kid's birthday, I may struggle a little bit. But if you ask me about certain papers, I can do that.
Great. Thank you. Vidar, have next
Yeah.
question.
Great. So, Dr. Spinner, Rob, you're not only a renowned peripheral nerve surgery, but also you've been chair of the neurosurgery department at Mayo Clinic for over a decade now. And I must say, everywhere you come and you tell that your mentor is Dr. Spinner, every neurosurgeon knows you. So if you've also made a large contribution to neurosurgery, and what are you yourself most proud of for your time as a chief of neurosurgery at Mayo Clinic?
Well, thanks. I've actually just transitioned this week from being chair for a decade. It's been a great decade, but I'm smiling now because the weight of the world is sort of off of my shoulders. I think during the time, I really am proud of making a small department a bigger department. And big isn't better. I think what we've done is integrated expansion. I used to talk about Noah's Ark and things of that sort, just because we've doubled the size of faculty and everyone sort of has a wine pairing. So we've been able to considerably synergize amongst subspecialties. I think the thing that I'm proudest of is the young people that I've been fortunate enough to recruit. The one talent I think I've developed is talent identification. Really have gotten pretty good and lucky at hiring some amazing people. And I'd like to say that a lot of my young faculty not only are successful and full professor, I have people who are very prominent in their field and named professors, endowed chairs of people I hired less than a decade ago. Almost everyone I've hired has become a full professor at the Mayo Clinic. It's amazing. So I know how to identify talent and then hopefully develop their careers. I think a lot of people want to do things with their own career. What I've really enjoyed is helping people like you both, or young department faculty, develop their names and careers, because that brings me success internally. I mean, that's the barometer. No one will remember me, but if you have a generation of people like you, you can create a lot of energy quickly.
Yeah, that's right. So yeah, hopefully you now have more time because you were succeeded as a chair. Also to spend time with of course your wife Alex and your sons Max and Noah. But definitely you will do more research. And what project are you most excited about to do in the future?
Well, I think the biggest project I have now is to help my new chairperson. Dr. Zadeh is coming from Toronto. Toronto, of course, is extremely well known for peripheral nerve. So one of the other people that inspired me early on was Alan Hudson. And then, of course, Raj Midha, who is well known to this organization, has been an early and sincere friend of mine and past president of the ASPN. Toronto's had a great history of advances in peripheral nerve, but also in leadership. Alan Hudson went on to run the whole system in Toronto. and they have a legacy of creating academic neurosurgeons. So for me now, my biggest project, and I use that euphemistically because the chairperson doesn't need my help, but I want to be the best ex-chair in the history of the world. I have nothing but love for Mayo and nothing but respect for the new person. So really, that's going to try to catapult what we do in neurosurgery at the Mayo Clinic as a team. I think in peripheral nerve, there are a lot of things that I've thought about over the years. The new chairperson is very interested in the genetics of tumors. That's her main focus, but from an intracranial perspective. This is what she's done with GBMs and meningiomas and things of that sort. Well, I think one of the things that peripheral nerve needs is earlier identification and the meaning behind some of the rare tumors that we see and treat. That's just one thing that obviously comes to mind. But I think using her skills now, we can synergize so that we can take the brain advances to the periphery.
Great. Well, that's good to hear. We look forward. Andres.
Okay, we are going to go for the last question, and it's about the work-life balance. This is one of the problems as surgeon that we have to deal with. And during my clinical fellowship with you, Dr. Spinner, I think I learned a lot about peripheral nerve. That's clear, but not only. I was able to be with you and to learn how you manage your balance as surgeon, as researcher, as mentor, as leader, as husband, as father. So could you give to the audience some tips or how have you been doing all these years to be able to keep your work-life balance?
I probably am the worst person to ask about balance. What I've gotten good at is accepting my imbalance. I think when we struggle for sort of that magic balance, it puts you in a mood to realize that you're failing. And I think if you feel like you're failing, then you are failing. And then you don't stand up straight. I accept the fact that I'm imbalanced and I'm always struggling to have better posture and to be better balanced. But I'm comfortable with the imbalance because I know where my priorities are. Family first. Everything is about family. Now, the trick is when you're with your family, is all the ideas that you have is how to multitask. And I've watched a lot of soccer games and baseball games, and I'm writing notes to myself to come back to. That's multitasking. But the family is first. Now, as far as research and all of that, I would say that every patient has a story, and every story is unanswered. So if you think about that way, work becomes fun, work becomes research. And if family is first, you have a imbalance that you're now working with. And then I would just say, think about your research in creative ways. One of the things, getting back to what am I proud of as being a chair, is I gave everybody a little bit of protected time. I had to fight with my administrator in Mayo because everything doesn't have to be about RVUs. You have to be inspired. And if you're not inspired, you're not going to have joy. And if you're an academic person or you have academic ideas, then you need some time to be able to think. And I think if you're able to think creatively, then you need to write down those ideas because to me, they come in the middle of the night. So I write down little ideas at 2 a.m. and then I try to revisit it and have trouble reading my chicken scrawl. But I would just say finding joy at work makes it not work.
Great. Well, thanks so much for the interview. It has been a great honor for me, and I'm sure for Guidar the same.
Definitely.
learn every time I listen to you, I learn a couple of new things. You still have a big future as mentor, as researcher, as clinical surgeon, and I hope we can still learn from you many, many years. And please, if you want to say anything else for the whole ASPN society at the end, feel free to point out whatever you want to.
Well, I would just thank everyone once again. I would also just say I remember sitting in the back room in 1997 at my first ASPN meeting and watching Alan Bellsberg put together a talk at the last minute with this new technology called PowerPoint. With this award, I realize a few things. Number one is technology is good. So I remember putting together slides and then dual projectors and slides getting caught in projectors. And now you put together the talks at the last minute on the plane or in the back room like Alan Bellsberg. Alan and I have become good friends over the years. I stress that because I mentioned Raj, I now mentioned Alan. I look at you guys and you're calling me doctor. You know, again, I always said that Dr. Spinner was my father. When I hear that, I look for my dad. My residents never knew what to call me. It was kind of a joke here because Mayo's very prim and proper and formal. And we always would call, Dr. Spinner, sir, that kind of thing. And it's like, no, I'm Rob. That's who I am. And they struggled with that because Mayo's so formal. When I look at you guys and I think of our friendships and I look at, Andres and I think about your Barcelona and Godard, I think about Denny's, which is no longer here. Denny's is no longer here, but our friendships are. And when you could make joy at work and friends at work and friends through work, then the natural history of peripheral nerve is going to soar. I'll end it there, but thank you. And the last thing I would say is these awards are very well taken and well meant. It doesn't mean we're getting that old, though. So I would like to think about this award as a celebration of youth because I've got a lot to go. Thanks again.
Dear Rob, congratulations with the Distinguished Leadership Award of the ASPN. You really deserve it. Not only have you made a tremendous contribution to the knowledge of peripheral nerve, and more specifically peripheral nerve surgery, but also have you mentored numerous students, residents, and fellows from all over the world, of whom many will be there on Hawaii. I'm sure we're all going to celebrate this together with you later and drink some of our favorite beers. But for now, enjoy this special moment. Cheers.
Rob, you made me love nerves. You taught me how to think critically about nerves and how to find solutions. Thank you and congratulations.
Dr. Spinner, congratulations for this ASPN award. You have been the best mentor anyone could ever ask for. You know you changed my life, and for that I'm forever grateful. Enhorabuena.
Congratulations on receiving the ASPN Distinguished Service Award. There is certainly no one more deserving. It's one of my greatest points of pride to be able to say that I trained with you. You've made innumerable contributions to the field in research and teaching and education. You are definitely the true triple threat. I am now passing on many of the lessons that you taught me to the people that I'm training, and in that way, your impact can't be measured. Thank you for all that you've done for me. Thank you for all that you've done for the field. Again, congratulations on receiving this award. Very, very well deserved.
Hi, Rob. Congratulations on this very prestigious award that you're receiving. It's a serious and important honor from an organization that's dedicated to peripheral nerve surgery. This acknowledges the extraordinary contributions you've made over the years, the impact you've had on countless lives, including patients, including trainees and colleagues. Your dedication, your vision, your tireless effort that you bring not only has set a very high standard, but has inspired so many to follow in your footsteps. Those of us who know you well know the passion that you bring to everything you do, not just to peripheral nerve surgery, but to the training of fellows, to the institution, and finally to the family life that you celebrate as well. This is really something to celebrate. It's a very well-deserved recognition, but it's just one of many milestones in such a celebrated career that you've had. Wishing you so much continued success and fulfillment in everything that you do. Again, congratulations.
Rob, you're so deserving of the Distinguished Service Award. Since serving as a Society Scientific Program Chair in 2006, you've served in all levels of the executive and provided great leadership. Your teaching, mentorship, role modeling to our young and upcoming members is especially noteworthy. Rob, you're the quintessential peripheral nerve academic, and I think some would say geek, but we all love you and you are someone that we aspire to be like. Congratulations.
Aloha, Rob. As this year's president, I would like to congratulate you on receiving the 2025 Lifetime Achievement Award from ASPN. I think that as a member of our society, you represent what is best in our membership. Your dedication to clinical and basic science discoveries in the field of peripheral nerve, your leadership, both of our society as its past president, and within the field of peripheral nerve surgery, and your dedication to teaching our next generation of surgeons and scientists over the course of your career have made you a very worthy recipient of this award. Congratulations for this tremendous honor.